There are a number of criteria that I use to decide when a patient is suitable for an abdominoplasty or tummy tuck. So firstly, they need to have stable weight for at least 6 months to ensure that there's no abnormal weight fluctuations both pre and post-operative. Secondly, patients who have back pain due to muscle separation, who have urinary symptoms due to muscle separation, and who also have rashes or skin infections from excess skin folds that's impacting not only functionally but also on their self-confidence, they would benefit immensely from having an abdominoplasty procedure. Patients that are poor candidates for abdominoplasty generally are encompassed in these categories. So usually they've done crash diets, or the weight is yo-yoing between month to month. They're very poor candidates because their weight is going to fluctuate after surgery and is going to make a 100% result down to an 80% result, which they might be unhappy with. Secondly, if they are smokers, that is a high-risk scenario, which leads to increased risk of wound complications, such as infections and wound dehiscences. And so I personally will not operate on any smokers unless they have quit at least 6 weeks before and after surgery. And thirdly, if the patient has a lot of intra-abdominal fat, so they may be stable in their weight, but their BMI is sort of approaching above 32, I also consider that to be relative contraindication for an abdominoplasty, because they're not going to achieve the cosmesis that's required. We can address the fat on the outside, but we can't get rid of the fat on the inside that's around your internal organs. And so I encourage those patients to ideally aim for a BMI of less than 28 to 30 to get the best results from their abdominoplasty operation.